Hello everyone, I'm Professor Roopali Khanna from SGPGI Lucknow, Department of Cardiology, and I think I attend this conference every year. So conference is basically dealing with your imaging and physiology of the patient's coronary arteries, which we do procedures, and how we can make these procedures more safe and more efficacious. It's basically this about. And the reason for attending this conference every year is that you can come to know about the new technologies which are there. So, like every year, we have some new indices, new technologies. Like my talk on this session was your microvascular dysfunction, which was like earlier never used to discuss in the conferences, but with the availability now coming few months, we'll get a machine which we can assess the microvascular function in these cases, and which will be very helpful in patients who we choose to diagnose them as a non-cardiac but turning up it to be cardiac disease patients. So that's the main highlight of this conference. That's why we have good attendance and good participation in these conferences, because you come to know about newer technologies, how you can patient safety can be improved, how the clinical data can be better in these cases.
So many doctors will share them.
Mhm.
Everyone share their experience in special.
In you want to say about the conference or somewhat about the technology which we are talking
Technology
about?
and their experience in the conferences.
So if you ask me whether what positive feedback will you give this conferences, because it gives you confidence to use these new technology in your patients, because you meet with experts, you meet with international faculty, you meet with national faculty who has used these technologies. So you interact with them, you see that how safe these procedures are, how effective these procedures are, and how easily it can be done. So if you see in our clinical practice, by attending these conferences, our clinical practice really changes a lot. In these cases, we use more imaging, more physiology in our setup so that good outcome can be given.
Thanks.